Something else that I'm seeing in the community, even here in my great city of Stonecrest, is that we're seeing an issue with children and nutrition. Can you speak to that a little bit and how that's impacting the increasing healthcare issues?
Well, yes, there are major nutrition issues. For a whole entire, we could have a whole seminar on nutrition. Some of it has to do with resources. Some of it has to do with the rising cost of food, and much of it has to do with education. So most people are not taught from a very young age how to eat. And by the time you figure that out, you might be overweight or unhealthy or what have you. So yeah, the previous question regarding obesity directly connects to the question about nutrition. And I will tell you that traveling to other countries, there are McDonald's in other countries, but there are not nearly as many overweight children, and that just speaks to the fact that our activity level is different. Our kids don't ride their bikes as much, and it's just television and tablets. So if we could improve that thing, we could probably improve the nutrition and obesity.
When it comes to autism, nutrition can be a big issue, and it's not so much about what they're eating or not eating, it's how they eat. They get into these routines. Like I had one child I worked with that would only eat orange things. That's it, nothing else. And so there's very limited orange things that you can give them that are healthy for you. So how do you try to work past that? And those are the types of issues families of children with autism are running into. Or they'll only eat a certain kind of food. We had another child that only ate black label bacon. And mom kept a black label bacon container, put like Publix bacon in there. The child knew it was different just by the way it looked. So there's just something where they just latch on to something. And so we have to support the families on how can you give them other opportunities? How can you sort of use those specific foods they eat for trying other foods? Taking more of a behavioral perspective can help if it's one of those types of issues. But I do agree, some of it is just educating everyone from young ages on how do you eat healthy. We run a preschool program, and we struggle every day with how do we have a snack that the children will want to eat, but it's going to be healthy enough that the parents will be happy, the children can get their nutrition, because as a daycare, we do have to provide a certain amount of nutrition for the children. We have to make up if the parents don't send in a lunch that is nutritious. But how do we do that around all these other issues? And with people that have so many different likes and dislikes can be very hard. So it's not something I have an answer to.
Yeah, I think the therapy world is moving towards whole health. So more than anything, we want to encourage people to be the healthiest people that they can be all around. And that includes nutrition. I think I've worked a lot with teenage girls specifically, but with teens in general, you can see the self-esteem, body image issues that can arise, or even weight gain as a side effect of medications or depression and anxiety. And so a lot of times nutrition is something that I end up talking about in my sessions. Also, making choices, right? That's something that we want our kids to be able to do, is to make good choices or be able to hold off on impulses. And a lot of times that comes out with food. So if there's cookies sitting in front of me, I have a choice to eat that cookie. What's the consequence of eating that cookie? Things like that. And so even though it seems minor, it can affect other areas of the child's life as well.
And before we open it up to the audience, because you'll get to ask each one of these experts your own question, but before we go there, I want to talk about technology for a moment. When I was growing up and I went to the doctor and he wrote in his chart, and it was just a physical chart in a folder like this. Now, based on what you're seeing today, how is your institution that you're employed by, how are you delivering more efficient services by employing some type of modern day technology?
This is a huge one in the mental health field of how, Dr. Buffington was speaking about rural areas and the access that some people don't have to therapy, and so telemedicine is something that's really big, but we're navigating how do we keep people's privacy intact, but how do we give the care as a therapist that we need, and doing therapy over something like Skype, or I've seen lots of services of like texting with therapy as well. But how do we keep the integrity of making sure that I'm doing my job as a therapist, in those types of services? So yeah, it's something that I think our field is trying to navigate. I also think there's some really awesome apps out there that can help people track their mood or help with coping skills. Crisis lines are now having crisis text lines, so some people that feels really, really vulnerable to call a line and be like, hey, I need some help. But it feels a little bit easier to text something. So that's something else that's coming up in our field that I think is really cool.
At the Autism Center at Emory, we're really struggling with technology because how do you, especially when it comes to diagnosing a child, so many kids, we hear from parents, the doctor spent 5 minutes with my child and now they're diagnosing him. How can you tell they have autism in 5 minutes? And so we're trying to get out, how can we sort of expand the diagnostic portion? So we are working with a company from Idaho, an app that a physician or a psychologist can prescribe to a family. They can get this app and then they take 4 videos of their child and it gets uploaded, and experts like us would view those videotapes for different autism behaviors, and then we would then send you a report off of it. It kind of worries me a little that we're really not touching the child. To be able to diagnose any mental health issue, I think you kind of have to be interacting with them. You have to have more interactions with the parents. But it is something to give you information. Another thing, if you have young children, if you don't know about, CDC has an app that you can download to your phone called Milestone Moments that has it, I think it's every 2-month interval from birth to age 6. I think it may go up to 8, where it tells you what milestones, both socially, language-wise, motor skills, cognitive skills, things like that, gross motor, fine motor, that your child should be doing, and you can check off. These are the things my child's doing, these are the things they're not doing, and then it will give you things to discuss with your primary care physician on how do you bring up these topics. So you can start tracking your child's progress to see are there things that they're not meeting earlier and earlier, and I think that type of technology is very helpful for families. Because I know when it comes to autism, a lot of times families go to the doctors and say, don't worry, he's a boy, he'll talk late. Don't worry, it's okay. Don't worry, don't worry. And then 5 years down the line, the parents get a diagnosis and they're like, okay, I'm not crazy. There has been something wrong with my child. And so I think really how we can use technology to get the parents' input, because you know your children best, is what we're trying to work on, and how we can work with that to get a diagnosis. Once it comes to treatment, it gets a little more difficult, and so we're working with the same company from Idaho on doing an app where parents can videotape a treatment session, send it to a clinician, they can then look at it and give the parents feedback. That way, because telemedicine sometimes it gets too, it's not clear enough to really see if they're doing the treatments correctly. So we're trying to use apps more that way, and also work with schools on how they can take data in school and send it to an expert to look at and to give them feedback.
So I'm more of the traditional pediatrician, so I work with a company called HealthTap in addition to having an outpatient practice. And what HealthTap is it's an app that you can download, and you can say, I have a runny nose, and you can video chat with me, and I can see your runny nose, and we can talk about your symptoms, and then I say, okay, well, I think you have a cold, you're gonna be fine. Or I say, I think you have sinusitis, and I can actually e-prescribe on the app. This has interrupted much of my life. My kids know, my husband smile at me because I never turn it off because I love it. I had a parent that moved to this Indian reservation somewhere, I don't remember. And the mom, she was in between pediatricians, so she had left me, but she hadn't established with her 5 kids on this Indian reservation, but she had health taps. I told her, I said, before you establish, if something happens with your 5 children, you just health tap me and we'll handle it. So she video chats me and her kid is like crouping, you know, the kid's just crouping so bad. I'm like, oh no, I knew this was gonna happen. But it was great because I could hear the kid crouping and